Thank you, Frank. I want to thank the organizing committee and the vision that they've had for 5 years to make this program go. I have no disclosures. I have one comment. I think this session's misnamed. I haven't heard anything about cutting, or much about cutting in the last few talks. I've had the privilege to participate in the first FDA randomized trial for bone marrow transplants to save limbs, and I'm going to bring up to date on that trial and what's going on around the world. This is truly a disruptive technology, and I think within 5 years will be an important part of what we do to save limbs. Our job is to save limbs, and this is the group of surgeons and interventional radiologists at our Heart and Vascular Center in Charleston, Roper St. Francis, who've been working on this actually for the last 3 years. These are the options that we all currently use every day to try to save limbs. Angioplasty has certainly taken on a big part of this in the last few years. I think many of us are beginning to realize the limitations of that. Surgical bypass has been around and works, and we still have to do too many amputations. And I will suggest to you that the next part of the armamentarium for this will be autologous bone marrow transplants. This is how this works. Bone marrow stem cells are produced in your iliac crest. These CD34 cells actually migrate to areas of hypoxia, set themselves up there, and over a period of time, usually 3 to 6 weeks, vasculogenesis occurs in about 70% of patients. It's a pretty remarkable process. This has been going on now for at least 10 years. There are various ways to do this. All the previous techniques have been slow processing. You've got to take the cells to the lab for hours or days. You couldn't do it right in the procedural room, and it required large volumes of bone marrow aspirate. Those are the older techniques. In the last few years, a company in Boston, Harvest, has developed a high-speed centrifuge that allows you to do this in a period of about 15 minutes in a procedure or operating room. It's a nice little device shown here. The first FDA randomized trial for bone marrow transplants began in 2007. Mark Iafredi at Tufts was the primary clinical investigator. There were 8 study sites involved with this. We were one. The FDA approved 48 patients. We've actually done 11 of these patients in our center. The cells are actually injected into the leg in the areas where the vessels are obliterated. And I just want to acknowledge the individuals at our institution who really have been the guiding forces. George Giles Jr., who's the head of our transplant program, is an oncologist, pretty well known in this country, has been behind this, and Lori Bennett, our study coordinator, really made this trial go. The criteria to get into this have been severe, and if you look at the numbers up here, you know that these patients have critical limb ischemia by any criteria. There were no patients in renal failure, and the patients could not have had a bypass or a PTA within 3 months. So getting into this trial was difficult, and actually we're going to expand or liberalize these criteria in the next phase. It's a randomized trial. It was set up so that 2 patients would receive the bone marrow cells, and 1 patient would receive peripheral blood. Now, peripheral blood has CD34 cells at a lower concentration, so really it's not a placebo. It's a comparison of highly concentrated bone marrow cells compared to the circulating CD34 cells. And the endpoints were amputation-free survival, improved pain-free walking distance, improved quality of life measured by the SF-36, and then all the usual vascular lab to show improved perfusion. So the cells are drawn off the iliac crest by the oncologist or hematologist in this trial. They're prepared in about 15 minutes. And then you have 4 syringes of cells, which you inject just like giving small vaccinations, 1 cc aliquots injected along the course of the obstructed vessels. It really is an easy procedure. It takes total time, an hour. Patients come in outpatient. They have very little pain. They go home that afternoon. It was not as complex as we thought it would be. So the beauty, outpatient procedure, intravenous sedation, really minimal pain and discomfort. Here are the kinds of patients we've been treating. On the left, you can see before treatment with the low transcutaneous oxygen levels, and on the right, the ones who've gone on to healing with improvement in their peripheral oxygen levels. Last week, we met in Atlanta. We have done the 48 patients. We finished this phase of the trial, and you can see the so-called placebo group shows some improvement in the Rutherford classification and then deteriorates by 12 weeks, but the patients receiving the bone marrow cells actually have improvement in their Rutherford class that lasts out to 12 weeks. And I have some patients for 2.5 years now with limb salvage. There are 6 published trials now. There are 286 patients out there in the literature as of a few weeks ago. The limb salvage rate is 60% at 6 months. These are all patients who would have had their leg in the bucket at 6 months. So this limb salvage rate is fairly remarkable. This is a study from India. This is one of the Harvard-associated hospitals in India showing the decrease in pain in patients undergoing this type of treatment, the improvement in the Rutherford classification, improvement in ABIs, improvement in transcutaneous oximetry. So other centers around the world are doing this with reasonably good results. So I think what we are learning, and this really is the early phase of this kind of treatment. This is sort of the transistor phase before you develop the iPod. This is early on, but bone marrow transplants can reverse critical limb ischemia in 60 to 70% of patients. And I would predict that someday it may be the initial, not the last treatment for critical limb ischemia, especially patients with very advanced claudication and rest pain. And our next trial is actually going to liberalize the criteria to get more of those patients into the trial. We're in Charleston. If you're ever up there for a visit, give us a call. Be happy to show you what we're doing. Thank you.